After studying this module, you shall be able to know more about positive growth following disability, learn about the enduring characteristics and individual differences, and understand the psychological interventions in this regard. Psychology has always been interested in what has gone wrong in people's lives and the consequences of it. The same view has prevailed regarding physical disability, wherein physical disability is associated with negative consequences for the individual in terms of diminished mental health and well-being. However, with the coming of positive psychology, interest has been generated on positive growth following acquired disability. Practitioners of positive psychology study people whose lives are positive even after disability and try to learn from them in order to help others achieve the state of happiness. It is a scientific study which can equip sufferers with the skills to stop downward spirals and help them focus on the positive aspects of their lives. Physical disability can occur due to many reasons. Physical disability may occur due to trauma or disease, which can lead to a reduction in function or the loss of a body part. Example, limb amputation. Restricted activity or physical loss due to disability can have negative psychological consequences like depressive symptoms and problem behaviors in the individual. However, this is not always the case. Many people with disabilities do not suffer from depression or behavioral difficulties. Instead, they adjust to the circumstances quite well. Following disability, many individuals report high levels of subjective well-being and happiness. They also enjoy their daily life, work, play, and interactions with family and friends. Physical disabilities involve varied challenges due to compromises in people's physiques. Physical disability is not merely intrapersonal but also an interpersonal phenomenon according to Dunn. Dunn and Doherty 2005 related positive psychology's 3 levels of analysis. Subjective experiences which take into account people's attitudes related to the past, personality traits and positive public virtues. The changing focus. Through guidance, people can learn that disability can be seen as a familiar and even beneficial quality of the affected individual. Wright advocated that people with disabilities, psychologists and rehabilitation professionals should familiarize themselves with a set of value-laden beliefs and principles. The 20 beliefs and principles offer a constructive and positive affirmation of the worth and dignity of people with disabilities. However, considerable research now reveals that relatively few variables actually predict even moderate levels of happiness. For instance, it has been found that higher income, education, and even physical attractiveness have little impact on people's happiness. Rather, being married, extroverted, or conscientiousness are stronger predictors of happiness. For researchers interested in exploring positive growth following acquired physical disability, Dunn and Brody focused on 3 related elements: positive connections to other people, positive personal qualities, and life regulation qualities. As mentioned before, researchers earlier focused mainly on the negative emotional reactions. Very rare mention of the potential for psychological growth has been mentioned. Prevailing models of adjustment were Freudian ones, in which people were presumed to pass through predictable stages in reaction to severe loss. Kurt Lewin observed great variation in reactions to physical disability. He stated that many people manage the negative consequences of disability by changing their values to experience increased personal growth. Learning principles have also been applied to identify the environmental contingencies that reinforce and shape disabled behaviors and produce impairment that is beyond what can be directly attributable to a physical condition. Positive growth following disability. Several theories propose that stress does not always result in negative outcomes and that some people may experience positive changes in values, attitudes and beliefs which emerge due to the stressful event. These changes have been described as positive illusions, benefit finding, positive reinterpretation and post-traumatic growth. Many individuals believe that their disabilities have helped them to find meaning or to be better at adaptation. These individuals reported appreciating personal worth regardless of appearance of ability, valuing time spent in family activities, and becoming more spiritual, thoughtful, or understanding. Individuals with a physical disability, with their resilience and clarity of purpose, may have greater resolve for pursuing personal goals and better psychological adjustment. Some family members report a greater sense of closeness, a greater emphasis on family and personal relationships, and positive changes in shared family values. Positive growth is reflected in a greater sense of well-being and satisfaction with life and associated with fewer psychological problems like depression, anxiety, social isolation and loneliness. An integrative and dynamic model. There are several basic principles in rehabilitation psychology. The first is that disability is defined to some extent by the immediate environment and the historical and societal context in which it occurs. Following Lewin's equation, that is B is equal to FPE, wherein behavior is a function of the person and the environment, observed behavior following disability is a function of the person and the environment. Adjustment following disability can be conceptualized in several broad domains. The primary components involve individual characteristics and the immediate social and interpersonal environment. These influences appraisal processes that constitute elements of positive growth, which in turn predict psychological and physical health outcomes. These components are framed within the developmental continuum that flows left to right. The dynamic continuum reflects the ongoing process of growth, adaptation, and development in the person and the environment, and the subsequent changes in interactions between these aspects. Let us understand the enduring characteristics and individual differences. Enduring characteristics are defined by the following. Demographic characteristics. Researchers take into account the racial, gender, age or socio-economic status differences as related to adjustment following disability. Disability-related characteristics. Changes in the physical condition itself can influence routine activities and behavioral patterns, thereby affecting adjustment. Third, pre-disability behavioral patterns. People who engage in health compromising behaviors and have problems in interpersonal adjustment prior to disability often face difficulty in coming to terms with disability. Personality characteristics. Persons who have an internal locus of control often report less distress than those with more external locus of control. Persons with disability who have effective social problem solving skills and positive orientations towards solving problems are more assertive, more accepting of their disability, and less depressed than people who lack these skills. Persons who are hopeful selectively attend to certain aspects of their situation following the onset of disability. Higher levels of hope and goal-directed energy are associated with less distress, greater use of more sociable coping styles, and higher self-reported functional abilities. Goal orientation also is associated with less perceived social stigma and increased mobility amongst these people. Cross and Rohe found that neuroticism and extraversion were associated with life satisfaction among community residing persons with spinal cord injuries. Social support has been associated with well-being among persons with acquired disabilities. Marital satisfaction following disability is associated with greater satisfaction in leisure activities. Satisfaction with recreational activities is a major aspect of overall life satisfaction following disability. Perceived independence, personal transportation, and personal living arrangements are strong predictors of good self-concepts among persons with a physical disability residing in a community. Phenomenological and appraisal processes. The appraisal component has considerable influence on adjustment since elements of positive growth are first evident in how people evaluate and interpret their situation. Following disabilities, adaptive people often look inward to exercise control over internal states rather than trying to exert behavioral control over external events. People try to accept, positively reinterpret, and seek personal growth soon after the onset of disabilities. People who ruminate about their perceived victimization are unable to find meaning and direction in their life, which may compromise their adjustments. Dynamic and developmental processes. Helen Keller is a strong example of adaptation to many limitations, such as blindness, deafness, and gender. Helen Keller is a strong example of adaptation to many limitations. People typically navigate developmental changes with the intention of minimizing their discomforts and activity restrictions and maintaining or improving ability levels, sense of well-being and volitions. Adjustment following disability. When people return to work or receive vocational rehabilitation services, they report greater well-being. Meaningful social and leisure activities also are important indicators of adjustment. Psychological interventions. The opinions, goals, and aspirations of the person with disability must be primary in developing strategic interventions. When these are addressed, interventions are more likely to be effective. Wright recommended that services to people with disabilities should include efforts to eliminate societal barriers, improve medical and psychosocial services, develop and provide assistive devices and technologies, and aid in the learning of new skills. Interpersonal and social skills training programs and innovative interventions have led to an increase in the sense of well-being and acceptance of disabilities among persons with physical disabilities. Cognitive behavioral interventions which enhance coping effectiveness may have beneficial effects on people's ability to positively reappraise their situations and increase cope and improve psychological adjustment. Strategies that include family members in the rehabilitation process have been found to be very effective. Formal vocational rehabilitation intervention programs that support return to career-related activities are very important. In fact, clinicians should take input from persons with disabilities and their families in order to develop useful services. Virtual reality technologies can be employed to enable individuals learn specific coping skills in dealing with persistent pain and attain greater mobility and independence. The strengths-based approach to personal positive change aims to make clinical psychology give equal weight to both positive and negative functioning. Interventions focusing on strengths and positive emotions have been found to be as effective in treating disorder as cognitive behavioral therapy. Grunzman defined positive intervention as a therapy primarily aimed at increasing positive feelings, positive behaviors, or positive cognitions. One way of using positive intervention as a clinical treatment is to use positive activity interventions. Positive activity interventions are brief, self-administered exercises that promote positive feelings, thoughts, and behaviors. Two of the widely used are 3 good things. This requires a patient to daily document for a week 3 events that went well during the day and their causes. Next is best future self. A patient is asked to think about their life in the future and imagine that everything has gone as well. They have worked hard and succeeded at accomplishing all of their life's goals. The patient is then asked to write down what they imagined. Scientific studies also show that there is a direct link between stress and the immune system. When a person experiences stress, their body is less able to shield itself from bacteria and viruses. Due to this, there is an increase in infections such as the common cold and cold sores. Having a positive outlook on life also equips people better for dealing with serious illness. Optimism and self-belief have a beneficial effect on recovery and ability to tolerate treatment in cancer. People who think positively have a lower incidence of cardiovascular disease. They tend to have lower blood pressure as compared to those who do not engage in positive thinking. Optimists have been found to have better physical and psychological well-being and better skills for coping with stress and difficulties. For some people, positive thinking comes quite naturally, while for others, seeking professional help is necessary to get them on the right track. About 70% of adults with disabilities are unemployed. Some interventions have been proposed that can increase optimism, resilience, and well-being among people with disabilities, which will increase their employment, educational attainments, and well-being. Studies also determine the effectiveness of programs that teach optimism and positive psychology skills to people with disabilities. Over the last 5 decades, considerable effort and resources have been spent to treat depression through psychotherapy and medication. Data indicates that the pooled effectiveness of all therapies is about 50%. One of the reasons for this limited efficacy of treatments of depression is that traditional treatments focus on the weaknesses of the depressed individual. Cognitive behavioral therapy and antidepressant medications, although effective, focus more on faulty cognitions and neural dysregulation rather than on the strengths of the individual. Positive psychotherapy for depression explicitly builds on the strengths of the individual. The central assumption is that depression can be treated effectively not just by reducing negative symptoms but also by directly building positive emotions, building engagement through signature strengths, and building meaning. In addition, this treatment also produces healthy outcomes such as social and community engagement, satisfaction with life, physical health, and better work performance. Let us now summarize what we have learned in this module. Psychology has always been interested in what has gone wrong in people's lives and the consequences of it. And the same was for disability too. However, with the coming of positive psychology, interest has been generated on positive growth following acquired disability. Physical disabilities involve varied challenges due to compromises in people's physiques. Physical disability is not merely intrapersonal but also an interpersonal phenomenon. Dunn and Brody focused on three related elements: positive connections to other people, positive personal qualities, and life regulation qualities. Kurt Lewin observed great variation in reactions to physical disability. He stated that many people manage the negative consequences of disability by changing their values to experience increased personal growth. Many individuals believe that their disabilities have helped them to find meaning or be better at adaptation. These individuals reported appreciating personal worth regardless of appearance of ability, valuing time spent in family activities, and becoming more spiritual, thoughtful, or understanding. Enduring characteristics are defined by demographic characteristics, disability-related characteristics, pre-disability behavioral patterns, personality characteristics, phenomenological and appraisal processes, dynamic and developmental processes, and adjustment following disability. The opinions, goals, and aspirations of the person with disability must be kept in mind while developing strategic interventions. Wright recommended that services to people with disabilities should include efforts to eliminate societal barriers, improve medical and psychosocial services, develop and provide assistive devices and technologies, and aid in learning of new skills. Some of the interventions that are used are virtual reality technologies, strength-based approaches, positive activity interventions, etc. Cognitive behavioral therapy and antidepressant medications, although effective, focus more on faulty cognitions and neural dysregulation rather than on the strengths of the individual. Positive psychotherapy for depression explicitly builds on the strengths of the individual.